Midtown Hospital has a long tradition of being the place to have your baby in Middle Tennessee. There are over 7,000 deliveries at this hospital, which makes us the largest OB hospital in the state. Roughly 15 to 20% of those deliveries are now performed in the resident training program, either by residents or by nurse midwives with whom we work.
So the residents here get very early hands-on experience because we have a smaller group of residents and because we have a lot of faculty for them to work with. It's not that they're on this huge team taking care of all these different cases throughout the day and having to share with their co-residents. So interns get to operate one-on-one with attendings pretty frequently and pretty early on.
Our clinic, the UTHSC-Nashville clinic, is the primary site where both attendings and residents will see all OB and GYN patients. It's in a very convenient location attached to our hospital building, and it's a site for all of our continuity clinics. In the first year, you will spend 2 months on clinic rotation, really honing those skills for OB and GYN outpatient care.
We do see a wide range of clinical scenarios, which has been wonderful. I see obviously patients needing surgery, contraceptive care management. I've also been able to do in-office procedures, and obviously seeing new OBs, so performing lots of ultrasounds. So there's just never a dull day in clinic.
The philosophy that we have is to consider each resident an apprentice in obstetrics and gynecology. You'll be working one-on-one with attending physicians. You'll be working to some degree with senior residents, but on our subspecialty rotations, you are directly working with attending physicians.
We take care of a tremendous number of underserved patients in this population. We've also focused through our own endeavors here and Ascension's endeavors to decrease maternal mortality with our simulation program. Our lab is such that we have really state-of-the-art equipment. We have 3 high-fidelity simulators and 4 or 5 pelvic trainers.
It allows them to experience emergencies that just don't happen very often, and to run through and have a mental clarity about each of the steps in the emergency in a low stress setting gives them that ability to, number one, ask all their questions, practice all of the maneuvers or the steps, so that in a real emergency setting, they're prepared.
We develop the curriculum in a couple different ways. So CREOG, as well as the American Board of OBGYN, will have topics that are testable, and we like to incorporate those topics into the yearly didactic curriculum. We also are flexible, so if there is a hot topic that comes out that we need to review, we can add that into our lecture time. We feel strongly as a program to hone public speaking skills with our residents, as well as making sure that they feel comfortable giving lectures. So there are actually many opportunities where residents are actually giving the lectures.
One thing as the generalist who's in charge of the robotics program for the residents is that during their intern orientation, we get them set up with the Da Vinci representative. Early on in the first and second years, we do get some exposure on the console to get the residents ready for when they are operating with the GYN oncologists and with the urogynecologists in their upper level years. I think some early exposure to the console allows them to get more cases earlier on in these advanced rotations, such that they get the case numbers that they need.
A focus on wellness is really important to kind of help prevent burnout and making sure that everyone is staying centered and grounded. And primary approach to wellness in our program is a preventative approach. We're frequently checking in with people to make sure that everyone is doing well. We have relatively frequent scheduled wellness events.
Physicians have a quoted rate of 50% of depression, and suicide is one of the #1 reasons why physicians end up dying. And so I think if we can do things to prevent people from getting to that place, that's so important, especially as John mentioned, it's just a very stressful, high-intense environment, and so making sure that you're doing the things that you can to prevent yourself from getting in that mental unwell state is so important.
Our overall goal for the program is to develop physicians who, upon completion of the program, are highly skilled surgeons and can make appropriate, good decisions in OB care.